So much of my thinking in this space has been inspired through partnership with Access Alliance. And so, much of what I'm talking about here relates to the work that I've done in partnership, that we've done together, Access Alliance and some of the research teams that I work on. So I wanted to sort of make that clear right at the outset. Just right up front, I heard this morning, I didn't attend this yesterday, but there's a network called the Institute for Pandemics at University of Toronto. They had a conference yesterday, and the Chief Public Health Officer of Canada was a keynote speaker there, Theresa Tam. And what she said was, the sort of punchline was that community-based participatory research is essential for the future of public health. And so I think the kind of dialogue we're having now and the kinds of collaborations we're talking about now, this is increasingly being recognized as foundational for achieving the kinds of communities and kind of community health that we want to achieve. So this is an outline for the talk. I'll say a little bit about community health, which has been thought about in different ways and will give us a good starting point. I'll talk about community development, and then I'll say a little bit about community health workers. Different from link workers, but certainly with a strong family resemblance. And as I mentioned, I think address some of the issues that were raised kind of through the panel and through Professor Bahavi's question. And then I'll talk about some future challenges and opportunities. And in putting these slides together and thinking through this conversation, it was kind of top of mind that everybody here knows what community health is. Everybody here knows what community development is. And maybe this is just an opportunity to step back from what we know in our everyday work and from our experience and from the real lived experience of these topics that many of you have, and just think about how they fit together and think about what kind of pieces and advocacy work we need to do and put in place in order to strengthen these, make them foundational for the next phase of healthcare and public health in Canada and beyond. So what is community health? So, community health to me is distinct from the idea of population health or public health in a few different ways. One sort of central reason for that is because it takes the community as the primary focus. So it's not just about the individual health status of all of the people who happen to make up a community, but rather is at a higher level of analysis, a higher level of abstraction to say, these are the things that make this community healthy, as opposed to, here are what makes these individuals healthy. And so, of course, that sort of leads to a couple of additional questions. One of which is what is community? How are we thinking about community? And there's a really intuitive and obvious way that a community aligns with a neighborhood. Neighborhoods are communities in important ways. And I think the work that's done by community-governed primary healthcare, comprehensive primary healthcare organizations like Access Alliance, that kind of community is really fundamental. These are the building blocks of cities, the building blocks of our everyday experience, the people, the social interactions that enrich our lives or shape our lives in various ways. So, of course, geographically defined communities are very important. But communities can be defined in other ways too. And the Canadian Institute for Health Research and the research institutes in Canada have an ethics document that governs how we do research in Canada. And they define community as a group that shares a commonality, any kind of commonality. So the Inuit community, for example, in what we now call Canada, is a community despite it being geographically dispersed across very large territory. So a community is much more than just a neighborhood. It can be understood in a variety of different ways. Now, community health as a concept, given these kind of different takes that we've already identified around what is community, it can be understood in different ways. So there is a conventional way in which community health is understood as the health status of the community. It can also, though, be community determined. What does the community say is community health? And this is what we see in some work from Access Alliance and others when doing a starting point around understanding what community health is. When going in to do work, to do community development work with the community, it's important to ask first, what does it mean to be healthy as a community? And then I say here also, community health can be interventional in the sense of saying, like, I do public health. Like, one can do community health, which means, so we're proposing here, and I think is intuitive to everyone here, it means you do community development and you do community health promotion. These things they are the practice of community health. So it can also be, thank you, can also be so this is a screenshot of community health needs assessment done by Access Alliance, where in Taylor, Massey, Oak Ridge, where they've led with strengths. What are the strengths in this community? Right up front, a sense of belonging, a significant strength and an asset. That doesn't mean ignoring the opportunities for development. Next slide. And also, of course, pose questions about opportunities. What needs to be done? What are the priorities? Things like housing affordability. We heard Rosie emphasize food. I think it was Rosie emphasizing food. Food stability and needs around food. So these things together, give a picture of community health. So community development has a standard definition from the United Nations, but I think it's worthwhile reviewing. A process where community members come together to take collective action and generate solutions to common problems. So pretty straightforward. It's not necessarily about health per se. Community development is not necessarily about community health, but it is about intervening in the social, political, commercial, and other determinants of community health. So, of course, community development is a way of intervening upon community health. And so here, for present purposes and in the work that I do in collaboration with Access Alliance, think about community development as a practice of supporting community members to build the capacities they need to come together to accomplish community health goals. So, you can see this is distinct from social prescribing. I only have a couple of minutes left, so I'm basically in the remaining time going to just define community health workers as a unique role and talk about the diversity in that role, point towards some evidence, because there's an enormous amount of evidence for these kinds of roles in achieving community health goals, partly through community development, and then just end off with some challenges and opportunities. So let's go to the next slide, please. In our work with Access Alliance, we're using this idea of community workers plus. And that's because there's an enormous diversity of different kinds of roles that do this work. A community health worker is the title that's been most familiar to us. And we've drawn on the definition from the Community Health Workers Network of Canada, which has now evolved to become the Cross-Cultural Health Brokers Network of Canada, which illustrates some of the flexibility in the title and the role profile. So you're thinking broadly, not just community health workers as a title, but community workers more generally. But community workers have different roles and responsibilities depending on where they work, but they share a common focus: promoting health and well-being, creating bridges between marginalized communities and mainstream services, addressing social determinants, strengthening community capacity, advocating for equity, catalyzing change. So this is a role, a well-established role that does that work of community development for community health. And this is something that I think is so important to invest in, and is why we've sought out funding and are collaborating with Access Alliance on a project on supporting the profile and practices of community workers in Canada. So, this is just to say, this is a screenshot of review level evidence, so like systematic reviews. Those kinds of papers review all the other research that's already been done on a topic. And there's many reviews illustrating how valuable and impactful this role is in countries around the world, including in high-income countries. And despite that, Canada has actually been behind in making investments in this particular kind of role. There are a variety of reasons for that, certainly something we could talk about. But when the evidence is so compelling, certainly there's a mandate, there's a call for action to work together, build a network that can advocate for deeper investment in this kind of role. So looking ahead, these are sort of the dimensions that we've uncovered so far in our ongoing project, and we're not even halfway through. We're working with 4 community health centers in Canada, 2 in Ontario, 2 in British Columbia, on a project where we're co-designing with community health workers and others what are the practice improvements that they feel would most strengthen their ability to fulfill their mandates. And there are a few insights that we've heard that have kind of shaped what I've put here in terms of looking ahead. So, first, building a pan-Canadian movement, including one that talks about scope. When we're thinking about funding lines and making policy investments in things, there needs to be a clear statement of scope and a clear rationale. And we can give those things to the policymakers, but there needs to be a network that can develop that. What exactly is the scope? How should we be thinking about it? It's a diverse set of practices, which is a challenge in bringing together, creating a scope for investment, but that's not an impossibility. It requires dialogue, it requires network, it requires opportunity, and close study to understand how people in these roles, they become parts of the community. They respond to community need. So to the extent to which there's diversity in community, there's diversity in these roles, and that's appropriate, and that's good. Second, creating a strong advocacy network for deeper policy investment. So this is about, some of these roles are funded federally. Community health representatives on First Nations communities, for example, there's federal funding connected there. Others are funding under provincial and territorial healthcare systems. So advocating for funding requires a sort of network approach across the country as well. Addressing emerging challenges, so ensuring that there's training around digitized health misinformation, how to address that, and highlighting the possible role of people in roles like community health workers around things like climate resilience. Clarifying pathways of impact through the determinants of health community development, as I've sort of outlined, and mobilizing this evidence into creating change. So my time's up. Thank you very much for listening, and we'll go on to discussion.